Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before measuring blood pressure, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Follow all additional instructions in the preparation section of this program. Do not take blood pressure on an arm with an IV infusion, with an arm cast, with a dialysis access site, on the site of breast surgery, that is injured. Ask the nurse if you are not sure which arm to use. First, be aware of the patient's baseline blood pressure readings. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided.
Good afternoon, ma'am. How are you?
Fine, thank you.
My name is Ellie. I'll be your nurse assistant today.
Okay.
Sorry to interrupt your reading.
That's all right.
Do you mind if I just take a look at your ID
Sure.
at the end? Thanks. And what's your name?
Jane Franklin,
And Miss Franklin, what's your birth date?
October 22nd, 1959.
All right, perfect. I need to get a blood pressure on you if that's okay.
That's fine.
Can I just borrow your magazine
Sure.
for a minute? I'm going to set it right over here. And I'm going to raise the bed up.
Determine the best site to use. For example, if she has an IV infusion in her right arm, use the left arm to take her blood pressure. After cleaning the stethoscope, earpieces, and diaphragm, position the patient lying down, sitting, or standing as ordered. Place her arm at heart level with her palm up. Expose her upper arm fully. Make sure you have the right size blood pressure cuff. For a very large or obese patient, use a large adult cuff. Squeeze the cuff to expel any remaining air and close the valve on the bulb. Using your fingertips, find the brachial artery on the inner aspect of the elbow on the little finger side of the arm. Once you've found it, place the arrow on the cuff over the brachial artery. Wrap the cuff evenly and snugly around the upper arm, at least 1 inch above the elbow. Now place the stethoscope earpieces in your ears and place the diaphragm over the brachial artery. Do not place the diaphragm under the cuff. For the next few steps, use method 1, 2, or 3. For method 1, use your hand to find the radial pulse. While standing no more than 3 feet from the manometer, inflate the cuff until you can no longer feel the pulse. Note this point on the manometer and then release the radial pulse. Place the stethoscope on the brachial pulse. Now inflate the cuff 30 millimeters of mercury beyond this point. For method 2, feel the radial pulse while you inflate the cuff to the point where you can no longer feel the pulse. After noting this point, inflate the cuff 30 millimeters of mercury higher. Then deflate it slowly, noting the point where you feel the pulse return. Then deflate the cuff entirely. After waiting 30 seconds, place the stethoscope on the brachial pulse and inflate the cuff again to 30 millimeters of mercury above the point where you felt the pulse return. For method 3, simply inflate the cuff up to 160 to 180 millimeters of mercury. If you hear a blood pressure sound, deflate the cuff. Then reinflate it to 200 millimeters of mercury. For all methods, continue by turning the valve counterclockwise to deflate the cuff, and let the manometer needle fall 2 to 4 millimeters of mercury per second. Note the point where you hear the first sound. This is the systolic pressure, which is near the point where the pulse disappeared. Continue to deflate the cuff slowly. Note the point where the sound disappears. This is the diastolic pressure. Now deflate the cuff completely. Remove the stethoscope from your ears and remove the cuff from the person's arm. If you will be taking an electronic blood pressure measurement, choose the correct size cuff for the person and the correct type of cuff for the machine. Squeeze the air out of the cuff. Turn on the machine and attach the cuff to the connector hose. Expose the upper arm fully. Now wrap the cuff snugly around the arm. Make sure that the arrow on the cuff lines up with her brachial artery. Also, make sure that you can fit only one finger between the cuff and the person's skin. Check that the connector hose between the cuff and the machine is not kinked. Then follow the manufacturer's instructions, setting the machine on automatic or manual and pressing the start button. When the measurement is complete, the digital display will show the blood pressure. As directed by the nurse and the care plan, set the frequency of blood pressure measurements. Upper and lower alarm limits for systolic, diastolic, and mean blood pressure readings, and intervals between measurements. After all types of blood pressure measurement, note the person's name and blood pressure on your notepad or assignment sheet. If you're not sure of an accurate reading, wait 30 to 60 seconds before taking the blood pressure again. Otherwise, return the cuff to the case or wall holder. In adults, the normal systolic pressure is 90 to 120 millimeters of mercury, and the diastolic pressure is 60 to 80 millimeters of mercury. As part of your post-procedure care, report an abnormal blood pressure at once. Perform hand hygiene and report completion of the procedure and your observations to the nurse. For detailed information, see the section on follow-up care, reporting, and recording in this program.
There you are, ma'am.
Thank you.
Need anything else?
No, that's it.
Okay, if you think of anything that you need or if you need any help, just press the call light right by your side.
Okay, will
All
do.
right. Thank you.
Uh-huh.